Let me bring in, well, here is more of what President Trump had to say about the failed health care bill.
They were not disloyal. They had their own reasons. I was very surprised when the two folks came out last night because we thought they were in fairly good shape, but they did. And, you know, everybody has their own reason. But if you really think about it, you look at it, and we have 52 people. We had no Democrat support, which is really, you know, something that should be said. We should have had Democrats voting. This is a great plan for a lot of people. We had no Democrat support. We have 52 people. We had 4 no's. Now, we might have had another one somewhere in there, but essentially the vote would have been pretty close to, if you look at it, 48-4. That's a pretty impressive vote by any standard.
Democratic Senator Maria Cantwell of Washington State joins us. She sits on the Health Care Subcommittee for the Senate Finance Committee. You just heard from the president. He said this would have been a really close vote. Is that how you view it on the ground on Capitol Hill?
Well, people can have conjecture about what would happen, but obviously the Republicans have been trying to put something together that a lot of our colleagues object to because it basically cuts people off of health care access. So I think both Democrats and many Republicans and many Republican governors have objected to cutting people off of Medicaid because it will raise everybody's premiums.
Look, this has been a problem for them. They've been trying to do it for 7 years. There's no doubt about that. But there is also an acknowledgement that something needs to get done to fix what is wrong with Obamacare. And a number of Republican senators now expressing interest in working with Democrats on a new bill. Will the leadership let that happen on either side?
Well, there's a lot of conversations that have been happening in the last couple of days between members. So I guarantee you there's a lot of bipartisan discussion about this. A lot of people have said, quit trying to repeal the access to health care that was expanded for millions of Americans and talk about this problem in the individual market, which is just about 6 to 7% of people and the way they get health care. Let's focus on that. And I think there's a lot of bipartisan conversations to happen.
So your leader, Chuck Schumer, did put out a statement last night. He urged a bipartisan effort. But look, a lot of the Republicans that I have talked to have laughed at that. They point, for example, to a New York Times article that just came out about how Democrats have perfected the art of delaying a vote on Trump nominees by requiring cloture, even for people they know that they're going to vote yes on. Do Democrats have any credibility when they say we all need to work together?
Well, I'm hoping that we'll spend our time, now that we're going to be here in August, working on bipartisan efforts, so stay tuned. We may have more news for you later on that. But yes, we're going to get things done. And obviously, people have been so concerned. If you're going to cut millions of people off their access to health care, there's a lot of people who are going to fight against that. And apparently, 70% of the American people say, yes, fight that. We don't want people cut off of health care.
So, Senator, where's this going? Be realistic. You know how it works there. You know what the mood is between Republicans and Democrats. You know what you just heard from the president. Where does this go next? Realistically.
Well, there will be a lot of discussion on both sides of the aisle, and then there will be some avenues of discussion about some things that can get done working together. And we're just going to have to let that play out. Obviously, today is a very big moment, and as you can see, just in the last hour, there's been a lot of changing news. So we're going to have to let that settle for a little bit.
Senator Maria Cantwell, changing news seems to be the order of the day these days. I thank you so much for taking the time to talk with us this hour.
Thank you.